In Nigeria today, especially in most undeveloped states, we are facing a challenge that seems impossible to overcome, a challenge of poor healthcare system. Hi, my name is Blessed Ngim and welcome to Ignition 633 Ministry. In this video, I'll be talking about the poor healthcare services in Nigeria and how it affects people. Most parts of Nigeria, especially the rural areas, are still struggling with issues like inadequate healthcare facilities, lack of medical professionals, and the absence of basic resources like clean water and medication. See, a patient goes to the hospital to meet a doctor to diagnose them, know what is wrong with them, and offer treatment. But at the end of the day, there are so many patients in the hospital, and oftentimes there are just a few doctors attending to those people. And at the end of the day, this patient goes back home without seeing a doctor because the doctors are not enough to see the patients for that day. So the patient keep coming back to the hospital just to see the doctor, and that is a major challenge. In many rural areas, healthcare centers are scarce. Most people have to walk miles away from home to get a healthcare center. Let's take, for instance, those people living at the IDP camp in Daudu. They have to travel miles away before they get a healthcare system. And even when they get there, the center is overcrowded. That is where you find patients more than even doctors that are supposed to attend to them. And then children suffer this. And instead of overcoming preventable diseases, they, at the end of the day, record losses because there are no doctors to attend to them and there are no treatments to even get at the end of the day. And this becomes a challenge. And elderly people also face this challenge because with chronic health issues, there are no doctors to attend to them, and so they just come back home and rely on the help of God. And aside that, people also fall back to local herbal treatment. And now you are getting plants to treat yourself and you don't even know what those plants are doing in your body. So it's also an issue because there is no money, there are no doctors available, there are no good health cares. People just rely on whatever is available. And at the end of the day, they even cause more problems to their system. We have our Ignition 633 campus physician who will tell us more about the poor healthcare system in Nigeria.
Okay, my name is Daniel Aga. I am the campus physician here and the coordinator of the medical team of Ignition 623 Nigeria. So it's been a great time working with the ministry. We had a lot of programs. We have a lot of medical programs we've carried out, and pockets of them that go on from time to time, even on campus. So working with a team has been quite interesting. The ministry is willing, always always ready to support us. However, a lot of challenges that are peculiar to healthcare in our environment here. So most of them, the major challenge stems from inadequate health personnel down to limited resources, and then lack of facilities, modern health facilities. So it has always been challenging when you see right now in our locality here, we have a population of over 6 million people residing in Benue State. But the last figures of doctors in working in Benue State was kept at 526 thereabout. So and the World Health Organization stipulates that in fact there's one doctor to 10 patients is a standard, but as we have it now, we have one doctor to 10,000 patients. So it's actually a very stressful time working in this terrain. Apart from the personnel, lack of personnel does not just cut across medical doctors alone. It goes down to allied health workers, the nurses, pharmacists, technicians, radiographers, and all that. So the limited healthcare personnel is not just to the apply to doctors alone. It cuts across all cadres. So what we do so far, what we do is, regardless of these challenges we put through, we still forge ahead. We make use of what is available in our terrain. We improvise. Particularly, we have experiences working with the IDPs, where we make use of what we have to deliver healthcare, and God helping us, we've been having results. So it has always been challenging. However, because from medications, there is a high rate of counterfeit medications in our environment here, and then lack of facilities, lack of skilled personnel. Then that is which goes down to quackery. We have a few persons who are walking around. Getting people who are skilled, certified, and qualified is quite an issue. A good number of persons, you see them, they are uh, involved in quackery. So that has always been a challenge. And most times, this quackery leaves the patient more damaged than he's supposed to be managed. So that is it. We basically make use of what is available to get what we can we want to achieve. So it's not really a rosy experience, but God helping us, we've been pulling through.
Ignition 633 Ministries have been concerned about the health of people, especially the people living in the internally displaced people's camp. That is why we've come up countless times with medical intervention. And in these cases, we take available doctors to the IDP camp, and then they treat people, diagnose them of whatever is wrong with their system. And for those ones that we were able to take care of at the camp, we administered treatment to them. And those special cases were referred to the hospitals, and then we paid hospital bills at the end of the day. We thank God for using us in this capacity to impact the lives of people health-wise. And we are grateful to God for the testimonies that were recorded and how He has used us to bring complete and total healing to the lives of people who originally just stay in their tents and give up on life because of one illness or the other that they have come across. Continue to join us in prayer as we bring this challenge at the feet of the Master, believing that He will provide funds for the country and Benue State government to provide equipment that are needed in these healthcare centers, so that people can be able to access those healthcare centers and get the treatment that they desire.